Muted.
Time to participate in this webcast, and thank you, Sylvia, for managing this. Before we launch into this topic, I would like, and especially for those of you that may not be familiar with NCFH, I would like to let you a little bit about the NCFH. We are a national not-for-profit organization, and we are dedicated really to improve the healthcare access to healthcare status of the agricultural worker population. And we provide technical assistance in several areas, most of them training tools and technical assistance in the area of management and governance. For example, some of the training that we provide is around cultural competency, agricultural workers identification, program requirements, orientation to migrant health, board trainings, etc. I invite you to go to our webpage and explore a little more about what we can offer. And also let you know that there is also a set of webcasts scheduled that are coming up also. This, the objective for this training today are actually, we have three objectives. The first one is to hopefully at the end of this presentation you will be able to understand the operational site visit process, to identify at a minimum, I guess, 3 preparation tips that you can adapt for your health center to help prepare for your visit, and then be aware of the availability of tools that can help you in that preparation. To accomplish those objectives, I would like to propose that we follow the following outline. First, we will talk about operational site visits, what's the background, the purpose, the process, etc. Then we will talk about the specific preparation tips, and then I will show some resources that you can access to help in that preparation. If that is okay with you, then we go to the first part, which is the operational site visit. In this part, we will look at several types of things. One is when the health center or the organization applied to the Bureau of Primary Healthcare, then we I'm sorry for the interruption, but I am hearing that there is a little bit of interference. Can you tell me if you are hearing okay? Just send us a chat and said if you are hearing fine. Okay, hearing on, I will continue it. So when an organization applies to the Bureau of Primary Healthcare for funding, and that organization is funded, then the grantee really establish a contract with the federal government. Like any other contract, the federal government has to monitor how that health center is meeting the program requirements. One of the ways that health center, that Bureau of Primary Healthcare does that is actually by conducting an operational site visit. The operational site visit, the whole purpose is to support the Health Resources and Service Administration, Bureau of Primary Healthcare program, and the oversight role and responsibilities that they have. So the process then for the operational site visit, I divided in three sections of process. One is the pre-visit, the second one is the visit, and then the post-visit. Each one of those, we will talk about each one of those 3 sections. We'll talk about who are the players involved and what is the role of each of the players in the process. So let's talk a little bit about the first process, which is the pre-site visit. First of all, your project officer or the project officer of your health center will identify the need for an operational site visit. What is the need? In this case, we are talking about in the past project period, do your health center have an operational site visit? And if it's not, then it's time to have one before your service area competition is due. So the project officer then obtains authorization from his or her superiors and then notify your health center about the incoming operational site visit and then negotiate a date with you or with your management team. Then the project officer requests a team of consultants. The team of consultants then is managed or identified by a contractor organization that the Bureau of Primary Healthcare has. Right now it's called the Management, MSCG is called it basically. And what it does is that group has access to the database that the Bureau of Primary Healthcare has about people who have signed and have been credentialed to conduct the operational site visits. Then once the consultants are identified, they are identified in base of their required expertise. There are 3 people in your team usually. That will be one person that will do governance, or says governance program requirements. The other person will do the clinical aspect of the project, and the third one will focus more in management and finance. So once a team of consultants is identified, then the MSCG will find out if those consultants are available for the day that your visit is scheduled. If that is the case, then the MSCG will also figure out or ask who wants to be the team lead for that team. Next, once the team leader is identified, the team leader then will arrange what is called a pre-visit conference call. That person is also responsible for develop the agenda for the call, as well as draft the agenda for the 3 days operational site visit. That team leader also is the established point of contact between the grantee, you, the project officer, and the consultants. That person is also responsible from arranging local transportation. It's many times the team leader talks about his or her responsibilities and basically says, and I'm the team leader, and what I need to do is to make sure that the rest of the team tell me where to go. That's the extent of the job in terms of that. So then once this thing happens, the team leader also will facilitate the entrance conference. Then once inside, each of the consultants will schedule interviews with key management and staff. The team, usually the 3 people in the team, or sometimes it's more the clinical and the governance, will then tour the facility. And then they conduct interviews, and every day, usually there is a debrief to the CEO, telling the CEO what can be found, what is going on with the assessment, etc. So that a CEO will not have a shock or will not have any surprises at the last day. So that's pretty much how this goes through. Now, there is also some more processes that need to take place here. The team is in your site for 3 days, 2.5 actually. Then at the end of the visit, the team leader facilitates what is called the exit conference, in which each consultant then shares the assessment results, and then the team goes home and start writing their individual reports. The individual reports then are submitted to the MSCG webpage, and then also those go to the team leader. The team leader then puts together the report and submits it to MSCG as a comprehensive report. From there, the report is reviewed by several people, not only for the MSCG, but your project officer and other HRSA staff, including policy, to make sure that all the dots are crossed. And if there is any need or any questions that any of the reviewers, report reviewers, meaning from MSCG, from your project officer, or from HRSA, have about any of the program requirements, then it goes back to the team review it as needed, and then it's finally submitted, and one day the grantee will receive the final report. All right, probably you know that there are 19 program requirements, and those are divided in 4 sections: the need, the service, management and finances, and governance. Now, in this section, we will not be talking about each of those program requirements, but I can certainly tell you where you can find the information, so you can learn more about each of those. I also want to let you know at this point that NCFH has scheduled 2 webcasts that are coming in terms of program requirements. One is going to be broadcast in Spanish and the other one in English. And if you are interested in learning more, please visit the webpage and also visit some of the resources that I will share with you later on so you can learn more for the process. Now, the best source of information about each of the program requirements and the best of the program requirements, as well as let me see, go back here, as well as what the information that the reviewers will be looking at, the documents that the reviewers will be asking for, is in this document that is called the Health Center Program Site Visit Guide. It can be accessed through the HRSA webpage. When you download it, make sure that it's the November 2014 for the fiscal year 2015 site visit guides. That is the newest, and that's where the reviewers are going to be using. So that can be found at the HRSA webpage, and I can also show you that a little later. Okay. Let us stop here and see if there are any questions that you may have. So Sylvia, can we check to see if there are any questions?
Yes, I am looking at the chat feature right now. I haven't seen any questions come in. If anyone has a question, if you can please enter it in the chat feature and we can answer that.
Okay, let me check. Am I going too fast or the pace is okay?
I think it sounds fine.
Okay, good.
On my end.
All right. If
now, Hilda, there
yes,
is one question here. How often can health centers expect an operational site visit?
Okay, the goal of the Bureau of Primary Healthcare is for each grantee to have 1 site visit for the 3-year project period. So the target is to have visit each one of the health centers at the 18th month of their of the project. However, there is a little backlog right now. So meanwhile, the Bureau checks, the Bureau catches up. The visit may not necessarily occur at the 18th month. Okay, thanks for the question. All right, let's then launch into the second part, which probably is the one that is more important to you. So let's talk a little bit about general tips. In this part, I will offer some preparation tips for each of the 3 operational site visit sections, meaning the pre-visit, the visit, and the post-visit. So using the chat feature, can you let me know if your health center is expecting a site visit in the next 6 months?
Okay. Haven't seen any answers yet.
Okay. Just at any time, please enter that information. It will be very useful. You don't have to mention your name, just yes or no. That's what we are looking for.
Okay. I do have one here saying no, Hilda.
Okay, thank you. All right, let's talk to the process and tips for the process, the pre-site visit. There is never too late to start preparing. So the earlier you start preparing for your visit is the better. Ideally, as I mentioned before, your operational site visit will take place in the middle of your 3 years period, meaning about 18 months before your service area competition. However, the Bureau, as I mentioned, does have some backlogs. So sometimes it is perhaps months or weeks before that visit will take place before your service area competition is due. So negotiating dates that are more convenient for you is very critical. So if you have the opportunity to negotiate, make sure to negotiate the dates that are best suited for you. Next, review the Health Center Program Visit Guide, which is the document that I referred to a few minutes ago. Then, study each program requirement and the required documents for each of those program requirements. and then gather and review all the required documents, which is a mountain of these documents. Next, mobilize your health center. Why is important here? Some health centers, only the top managers, perhaps the executive team, they know about program requirements. So it is very important that at a minimum, your board and your middle management know about program requirements in the site visit. The most people you have in your corner, the better you will do with the operational site visit. There are health centers that prepare the site visit involving and educating all the staff, just like if you were having a visit from the Joint Commission. So people get engaged and they own the site visit and they help you to prepare better. Then conduct, set a planning meeting for our committee. For the planning committee, make sure to include every representative of each department, because the site visit encompasses all the departments. And the more people you have there represented, again, the better that will be. So in addition of having your meeting, establish a committee to do the planning. Now, it is highly advisable that you conduct a mock survey. You can do the survey yourself, or you can hire somebody to do it. Either way is fine. Hiring somebody to do it is perhaps has the advantage of being more objective, the assessment, versus doing it yourself, but it's up to you, whatever you decided to do. So create a plan. Assign responsibilities and time frames. In your plan, I will strongly suggest that you have measurable objectives. What is the expected outcome, when that outcome is expected, and who is responsible for that. Then stick with the plan. I cannot stress enough how important it is, as well as monitoring the timely of meeting those goals and you may have objectives, and assessing then the progress in your preparation. It is really very important to do that. Now, the assessment has several components. The reviewers will observe, hear, review, conduct interviews, and ask questions. That's the only way that they will be able to really assess how your health center is meeting program requirements. And the importance of this is that they are looking how well you are meeting program requirements, and program requirements are based on policies. So it is very important for you to check each policy, and that each policy is current with HRSA policies. Now, update as needed and submit for board approval each one of those, each one of your policies. Make sure that your policies are well organized and identified. Include each policy, for each policy, the original date, the revised date, and the date of the board approval. Make sure that each of the policies that the board approved is recorded or documented in the board minutes. Do not wait. It is important to keep moving. Don't wait at the last minute, because if the data, you submit your board 200 pages of policies to be for their approval in one meeting, the most likely is that they really will not pay attention to what kind of policies they are signing, and it's kind of rubber stamp. You may be able to have a document that you have the policy and that the board has approved the policy, but maybe you don't have any time to implement those policies, and that will show during the assessment. In addition to that, reconcile each policy with related procedures and other documents. For instance, if you have the sliding fee scale policy, then that triggers the review of other policies, such as billing, such as how to do a sliding fee scale, etc. So all of those have to be reconciled. The last thing you want is to have some discrepancies between your policies, what is happening in the real world, and some process that doesn't merit with what else you have there. All right. Next thing that I would suggest is that you file the documents for the visit. And I would suggest that you do it by creating an operational site visit folder, add 19 subfolders, one for each of the program requirements, file each complete policy, procedure, and other required documents in that subfolder. For instance, if you have the folder for program requirement number 1, which is the needs assessment, you can have a copy of a narrative of your grant application, an needs assessment report, the UDS report, the map of your service area with the sites, Form B of your scope of services, a list of the sites, and the full address and zip codes of those sites, which is exactly what the site guide is asking to do that. Those are the type of documents that they are asking. Those are the type of documents that the reviewers will ask you to produce, and you will have them ready for them when they arrive. Next thing, let's talk a little bit about the pre-visit step. Make sure to participate in the pre-visit conference. It's up to the health center to determine who can sit in that pre-conference visit. Some health centers choose to have only the executive team. Some others choose to have management team. Some others have other people, and that's up to you, the grantee, to determine what do you want and who you want to be there. So next, I would like to ask if there is any questions related to this part so far.
Okay, I'll be looking at the chat feature. If anyone has any questions, please enter them there.
It's a very quiet group, huh?
Hilda, there is one question
that
I have here. What happens if we don't have all the documents available? For example, board minutes electronically. Do we need to scan those documents for the reviewers?
No, you don't have to do that. You can send the reviewers what you have electronically, and then especially if there are board minutes, which is sometimes is 1 or 2 binders, is no reason for your health center, if they don't have it already in electronically, to scan all of those. Just put them in a binder, make sure to identify them by month, and have a table of contents, and have it ready for the team when they arrive. So don't spend too much time in it. If you want to do it anyway, then it's up to you. Thanks for the question, Sylvia.
Okay.
All right. Let's go to the next process. The next process then is the visit. During the visit, again, the health center has the right to determine who, in addition of the project officer and the reviewer team, can participate as an observer. Some health centers invite the Primary Care Association representative. Some others invite perhaps a member of the regional network that they belong to, and sometimes both, and that's fine. As you as a health center have the prerogative to determine that. The role of the observer, though, is to observe the visit. They are not allowed to participate in the visit. And to, after the visit, of course, to provide you with the technical assistance that you may need to fix what needs to be fixed and to meet those program requirements that you didn't meet during the assessment. So, let's skip here. I don't have this question, it's just that I went in the wrong way. So next, okay. The next thing, which is very timely for the question that you mentioned and that you read a few minutes ago, Sylvia, is having the documents ready. You will receive, as a health center, you will receive a list or 3 lists, of depends, of what documents you will need to have ready for the reviewers, for each one of the 3 reviewers, as well as which ones are they would like to receive a minimum 2 weeks in advance or a week in advance. So why they need to do that? They need to do that because they have a very short period of time to learn everything about your health center. So what I will suggest is that you send the requested documents at the agreed date. If possible, have the documents available in a flash drive. Don't spend time figuring out which document goes to which reviewer. Just put all the documents in the three flash drives and send it to the reviewers, or send it to electronically to the computer so they can download it. And in any case, have them there ready for the team when they arrive. If those documents are not electronically available, then put them in a binder, as I mentioned. Make sure that says operational documents. Make a letter of identify each of those documents with the name, and then create a table of contents so reviewers know exactly in which phase they will find the needs assessment, or which phase they will have Form A or B, etc. Now, I still have the 3 flashes ready for them, and I will tell you why is this so important. As I mentioned previously, the reviewers have only 2.5 days to learn about your program. They also, most of the time, need to work at night. So they take the documents, they take the flash drive, and they are working at night to understand how your program works and to make sure that you have the policies and the processes there, and the process is working in the way it's supposed to be processing. But in addition, it's very helpful for them to take that flash drive back home, so when they are doing the report, they can refer to those documents, because the report has to be factual. And it's also very useful 2 or 3 months after the report is submitted, if anybody has a question about a program requirement. Either it was a met or a not met, they have a question for the reviewer, and sometimes the reviewer has to defend his viewpoint and has to refer to those documents again. So it is very useful for them, and they really appreciate having that information. Okay, the next thing is to make sure that you prepare a good workspace. And how you do that is by making sure that there is a work area that the team can use. It has to be accommodate 4 to 5 people, and they have to have access to secure internet, and they have to have some privacy. Why they have to have access to the internet? Because the report has to be done where they are there, and they have to access HRSA webpage. And 2, the privacy is because many times there is a consultation between one reviewer and the other to find out if the program requirement is met. Many times the reviewers have to be looking at the same thing with 3 different focuses. One from the focus of the governance, the other one from the management and finance, and the other one from the clinical aspect. So that's why also having all the documents in the flash TOM is actually very important. Okay. Next thing, orient the team to your program. So the team is there already. How you are going to orient them about your program? The easier thing to do, or the most effective way to do it, will be to prepare an overview of your program. Many health centers, what they do is to prepare a nice PowerPoint. Some of them put the PowerPoint or other documents in a binder or a folder for each one of the reviewers. However you choose to do it, make sure to talk a little bit about the brief history of your program, the mission and vision, what is your scope, how many counties are there, how many people you serve, what kind of special populations you provide services to, how many sites do you have, where your sites are located, who is your board of directors, who is your management team, how your staffing look like, how many people, how many doctors, how many, etc. What is the accomplishment you are more proud of, or several accomplishments, and you can talk here, and also what kind of challenges you are experiencing. This is very important to have this comprehensive overview. It's actually your time to brag about your program, and it's also the time to let the reviewers know what kind of challenges you are experiencing. Then provide a tour of your facility. Most of the time, the team would like to have the tour of the facility, but be prepared if the team wants to go to other sites. Most of the time, the clinical consultant will like to see one or two additional sites, especially if you have different populations or different special populations, how the program is working for them. So be prepared to do that. Next, let's talk about cooperation. It is very important to ask any kind of questions. Be transparent, communicate. I have been in a good number of operational site visits. Some health centers go out of the way to be transparent and collaborate, providing required information. Some others play the cards very close to their chest, and it is difficult to obtain the needed information. It's true that the team is there to do an assessment, but they are not your enemies. They are trying to do a fair assessment of your project or your program, and the more information that you provide of the required information, the better they are able to do the job. So cooperation is a paramount here. Reviews, if you don't have a document, you say so. You may say, you know, we are struggling with that, understanding or implementing that policy, and we will very much appreciate any kind of technical assistance that you can provide us. Then that is telling the reviewer, one, you don't have the document, or the document may not be what they are expecting, and two, you welcome technical assistance. Now, HRSA goes out of the way to say that these operational site visits are not only to do an assessment, but also to provide technical assistance, which is true. Now, the technical assistance that the team offers you will not be reflected in the report. The report is strictly whether you meet the program requirement and how you meet it, or why you didn't. So be prepared to take notes every time that the team is providing you some technical assistance, because that will be very useful once you start trying to fix what needs to be fixed, or trying to improve if there is a need for improvement. So reviewers usually respond much better to this approach rather than asking for one document several times to several people and just having the runaround. That approach is actually, the runaround approach is very, how can I say, energy consuming, and is not accomplishing anything. It's more just irritating perhaps the staff as well as the reviewers. So reviewers understand pretty good that your priority is patient care, and they do their best to work with you to minimize any disruptions. So whenever possible, have the key people available for interviews. So be mindful of vacation or any other activity that may prevent people from being available there. They are really very good reviewers in terms of making sure that if they need to interview your medical director, that is going to be in time that will not interfere with the patient's care. So same thing they will do with the board. They are very mindful to know that the board is a voluntary board, and that you probably have already scheduled one meeting that the week before, and now the board needs to come back. So work with the reviewers, with the team or the team leader and your project officer when you are scheduling the visit, to make sure that perhaps the board meeting happened with the site visit team is there, so your board don't have to come 2 times. Now, during the visit, it is important, and you will need to arrange for a 60 to 90 minutes meeting with the reviewers, the project officer, and the board. Not the staff is allowed for that one, for that meeting. So usually health centers do it over lunch or at the evening in a regular schedule for the meeting. So if the board meets every Tuesday at 6 o'clock in the afternoon, the team may be willing to be there Tuesday at 6 o'clock in the afternoon if that happened to be the days that the team will be on site. So work with them and they will be happy to facilitate as much as possible so your board don't have to come back several times. So it is very, very important that, to show good representation of the board. So make sure there are some members that, or all of the members if possible, that they will be at the entrance and exit conference, facilitate their participation if it's either by phone or by Skype or any other, using any other technology to make sure that you have good show of your members there. All right, let's talk a little bit about the post-visit. So now you can celebrate. Either you meet all the program requirements, or you can celebrate and the team is already gone. So either way, it's time for celebrate. But after celebrating, make sure to focus in what needs to be done and focus in the process, not in putting blames to anybody. So if things were not met, a program requirement was not met, it's not one person didn't meet the program requirement, it's that the process that you may have in place needs to be improved. So start working as soon as possible using the reviewer's comments or feedback. You remember when I said if they're providing technical assistance, make some notes. Those notes will be very useful to start working in those program requirements that were not met or those program requirements that require improvement. Then, once you receive the report, be objective in analyzing the report. Don't remember whether the finance person or the clinical or any other attitudes or any of these things. Just focus in the objectively review the report and say, okay, so what do we need to do in order to prepare to accomplish a program requirement? And by the way, if you didn't meet some of those program requirements, it will tell you exactly what you need to do to fix it. So start working on it. Now, next, work with your project officer to determine the actions to comply with the requirements. So let's say that you have some program requirements that you were not able to meet during the assessment, and now you need to meet. Which one you will do first? And how long will you take you to fix that? So work with the project officer and schedule those activities that you need to do in order to meet this requirement. Next, be mindful that it could be some conditions placed in your notice of grant award. So this is not, again, you have to take seriously those program requirements that were not met. Sometimes are just technicalities, and you can start working in those requirements and meet that requirement even before the report arrives, because you know exactly what needs to be done, and you can go ahead and do it. Now remember that sometimes the Bureau provide other not requirements but clarification in terms of X requirement. For instance, if you remember a few months ago, or actually it's more than a few months ago, the PIN for the sliding fee scale was announced, and that came up with a lot of things that needed to be redone or revised. So some of those things may be just technicalities, some others you may require not only to revise the policy, approve the policy, and then implement it with a sound process, so that can be accomplished, and you can show that to your project officer. So if there were any conditions placed in your notice of grant award, and this can be removed. All right. The next one, work with your team to meet deadlines, and that is also very important. Just like the way that you create your plan to prepare for the operational site visits, create your plan to fix anything that needs to be fixed. Finally, keep your project officer updated on the status of your corrective action. Your project officer should be your best ally. So make sure to work, establish good relationship, and take advantage of that. Okay, any questions about this? Sylvia, do we have any questions?
Yes, I have received a question asking where can we find the site visit guide?
Oh, okay, great. This is pretty good actually. I will cover in the next section which I am ready to start. So let me see. Here we go. Resources. The site visit can be found in the following resources here. This is the web page of the Health Resources and Service Administration. Here you can find program requirements. I don't know if you can see my little arrow here. This is the program requirements. And this is the blow-up of the program requirements. If you look at the upper right corner, it says download documents. There is the print-friendly health center program requirements, and then is the program guide. So you can check it from there, and you can, right here, you can download it from here. Okay? Next, again, this is the one, sorry, this is not the fiscal, the January, you have to look for the February, not the January one. And then I will show you, not show you, but I would like to point this web page to you, which is samples of templates and resource center. It's also a HRSA web page. You can find there policies, procedures, some tools that you can use by each of the program requirements. For instance, if you look at this mission, vision, and core values, there is another one that is a policy template. There is privilege and credentialing checklist. There are board of directors self-evaluations, etc. So you can find a lot of information here that can be very helpful for you to prepare. Next, for those health centers that serve the agricultural worker population or any other populations, you can look at this webpage, which is called the Partner Outreach. There you can find the national cooperative agreements, and by special populations, you can find also the primary care associations here. So you can click in those and see what kind of information they have there that you can use to prepare for your operational site visit. You can look for the Farmworker Health Network, which is this web page. And finally, you can I can direct you to the National Center for Farmworker Health. You can go to this resources page and go to the Management and Governance Toolbox, and you can find also there some resources that can help you. So that's pretty much all the information that I have for you and the time allowed. I know that you have a lot to work, and I appreciate you hanging in here, and hopefully we will finish before the hour is gone. So before I say goodbye to you, I would like to find out if there are any last minute questions that you may have about the topic.
Hilda, there is a question here asking, on average, how many program requirements are not met by health centers? And are there health centers that meet all the program requirements?
Okay, thank you. On average, well, let me preface that by saying, you know, if you don't meet all the program requirements, it's not the end of the world. You just have to work on it and put the things that are needed in place for you to comply with those. So on average, health centers have either 6 or 7 program requirements that are not met. Yes, there are some health centers, very few, that are able to meet all the program requirements. Some others may miss it with 1, some others may miss it by 15, and so, but on average, about 6 or 7 non-met program requirements is not unheard of. Any other question?
I do not see any other questions.
Okay.
And
Well,
Hilda,
yes.
before we close out, I wanted to remind everyone that a copy of the PowerPoint is available for downloading in the materials section of the control panel. So if you're able to see that, you can download it to print if you'd like a copy.
Great. Thank you very much, Sylvia. Well, again, thank you very much for all of you to take the time to participate in this brief training. And more than anything else, thank you for the work that you do every day to take care of your communities, including agricultural workers. So please let us know if there is anything we can do to assist you during this process or any other that you may have, and that we may have some expertise. So thank you very much again. You have a wonderful evening. Bye-bye.
Thank you, Hilda. Thank you again, everyone. Have a good afternoon. This concludes our webinar for today. And if you do have any questions, feel free to email Hilda or myself, and we'll be sure to address those. Thank you so much.